Thank you very much to all of you for your attending today. Today we have the pleasure in Proton Lecture Series to have Dr. Alejandra de-la-Torre, who's professor at la Escuela de Medicina en Ciencias de la Salud de la Universidad del Rosario en Bogotá, Colombia. She is PhD in Translational Medicine of the University of Strasbourg. She is also PhD in Basic Science of the University, la Universidad del Quindío. She's also uveitis specialist with more than 20 years practicing in Colombia and worldwide. Today we have the great pleasure to have her with her new topic that is quite interesting, and I think we all are going to learn many things, and is very relevant for intraocular inflammation, the work that she's doing right now. So thank you so much, Dr. Alejandra, for today's meeting, and thank you for being keen to attend and also give us all of these amazing talks.
Thank you very much, Carlos, for your kind invitation. And I want to thank also Dr. Rupesh Agrawal for inviting me to participate in the Proton Lecture Series to talk about this work, which received the Pan American Academy of Ophthalmology Paul Kaiser RRF Global Award. This work aims to unveil the immunogenicity of adalimumab through an in silico analysis of molecular mimicry with bacteria as a possible explanation. I want to thank the co-authors who did a fantastic work of a team job. I have no conflicts of interest. Adalimumab is a biological therapy anti-TNF alpha. It is a humanized monoclonal antibody with proven efficacy in non-infectious uveitis. Currently, it is the only FDA-approved antibody for non-infectious uveitis. It prevents relapses, reduces the use of corticosteroids, and it has a very good safety profile. It is at the highest level of treatments for non-infectious uveitis. That is why it is so important. It reduces treatment failure by 50% compared to placebo. However, primary failure in systemic diseases has been reported in up to 30% of patients with no response at the beginning of treatment during the first 6 months. And also, secondary failure has been described with good initial response, but loss of effect in up to 60% of patients, probably due to the production of anti-drug antibodies, which mean immunogenicity, leading to a reduction in serum concentrations and loss of effect. What are the factors affecting immunogenicity? Structural properties of the proteins, including protein folding, post-translational modifications, including glycosylation, and the type of antibody. Additional factors such as drug-related factors has been described, such as formulation, contaminants or impurities, route of administrations, technology, and the presence of adjuvants. There are also patient-related factors such as concomitant or prior use of medications, genetics, disease status, severity, duration of treatment, and regularity in application. But also there are unknown factors such as molecular mimicry. That's why we wanted to explore the molecular mimicry as a factor affecting immunogenicity. When we talk about immunogenicity of adalimumab, are we talking about anti-drug antibodies? Yes, we're talking about anti-adalimumab antibodies. As you already know, adalimumab is a monoclonal antibody that blocks TNF-alpha blocking immune responses that produce inflammation. But patients receiving adalimumab can produce antibodies against this monoclonal antibody. Antibodies against the drug can be binding antibodies or neutralizing antibodies. Binding antibodies are produced not against the effector part of the antibody, but against the Fc part. And neutralizing antibodies are addressed against the effector part of the monoclonal antibody, reducing its efficacy. But how frequent are anti-adalimumab antibodies in patients with non-infectious uveitis? We performed a systematic review and meta-analysis, and we found that anti-drug antibodies, the prevalence of these antibodies was almost 10%, and 12-month pooled incidence reaches almost 30%. Risk factors include lack of concomitant use of immunosuppressants, autoimmune diseases, and female gender. However, further research is needed to understand the development of anti-adalimumab antibodies. That's why we wanted to explore molecular mimicry. But why explore molecular mimicry? First, because emerging role of gut microbiota in autoimmune diseases have shown that alter microbiota and gut linked has been associated with autoimmune diseases. Second, because pathogen with cross-reactivity has been described producing autoimmune diseases, such as those related with Reiter syndrome, and, for example, Campylobacter jejuni that has been associated with demyelinating diseases and Guillain-Barré. Third, because microbiota has been important in the immunotherapy response with tumor regression versus tumor progression with favorable microbiota or unfavorable microbiota associated. And four, and the most important, because previous infections has been related with the developing of anti-drug antibodies. Patients with multiple sclerosis, rheumatoid arthritis, or intestinal bowel disease who developed infections during a prospective study had a almost threefold higher likelihood of developing anti-drug antibodies. And why are these antibodies produced? One of the explanations or hypothesis is because molecular mimicry, which means cross-reactivity. When the antigens of specific pathogens such as bacteria, viruses, or parasites have structural similarities with our own cells or some drugs, our immune system confuses what is own, no, not harmful, and what is strange or dangerous because of those similarities and triggers wrong responses. One of the examples that show us evidence of cross-reactivity of infectious agents and autoimmune diseases is SARS-CoV-2 molecular mimicry, producing immune reaction against spike protein or nucleoprotein, producing cross-reactivity antibodies and affecting tissue antigens such as gastrointestinal and tight junctions, skin, nervous system, thyroid, joint, muscle, and several cellular components, demonstrating the relationship between SARS-CoV-2 proteins and autoimmune target proteins. But how can we know if molecular mimicry exists between the drug in this case adalimumab, and structures the immune system recognizes as foreign, such as bacteria, through computational simulation. We call it in silico analysis. In silico analysis have advantages. This analysis can reduce expenses, save time, accelerate discovery rates, decrease the needs of animal and human experiments. They have high repeatability, and they allow access to complex data and exploration of different scenarios leading to a personalized medicine. In silico analysis have already applications such as establishing computational models of cellular behavior, analysis of genetic sequences by bioinformatics, and drug manufacturing through predicting failures and selecting the best devices or drugs in the early phases. So, in summary, what is our background and purpose? There is evidence of cross-reactivity of infectious agents and autoimmune diseases. There is also evidence of developing anti-drug antibodies against different biological therapies in patients with autoimmune diseases who had presented previous infections. But there is no evidence of cross-reactivity of infectious agents and adalimumab in patients with non-infectious uveitis. That's why we wanted to explore. This study aims to deepen our understanding of drug-induced immune responses and their role in reducing the efficacy of pharmacological treatments in non-infectious uveitis. By determining common epitopes of gram-positive and gram-negative bacteria and adalimumab, which can generate anti-adalimumab antibodies by molecular mimicry. We perform homology-based model. Protein structures were visualized using PyMol. Through an homology assessment, we studied the structural homology using Rodman square deviation, and we performed a global model quality estimation. And these global quality estimation scores were assessed to estimate the overall quality of the homology models and to identify the shared epitopes between gram-positive and gram-negative bacteria and adalimumab. We also perform a B-cell epitope prediction using ELIPRO server with predefined parameters. With the retrieval of previous described epitopes identified for adalimumab from the immune epitope database and analysis resource. Molecular mimicry analysis was conducted between bacteria and adalimumab, and visualization of conserved epitopes shared between adalimumab and bacteria homologs was displayed using three-dimensional model on the monoclonal antibody in PyMol. We study immunoglobulin domain preservation, making an analysis in bacteria, and the conservation of adalimumab amino acid residues was analyzed in several species of bacteria. Through specific algorithms and an empirical Bayesian approach, we study conservation rates and visualize this structural model of adalimumab obtained from the protein data bank using Chimera tools. We studied the similarity of adalimumab with antigens of the immunoglobulin domains of bacteria. And we found that, for example, E. coli has a similarity of 94% with the epitopes of adalimumab. Corynebacterium pyrovici producens have almost 90% of similarity. Klebsiella pneumoniae, 82% of similarity, Vibrio volnificus, 75%, Pseudomonas species, 67%, Helicobacter pylori, 62%, Salmonella enterica, 55%, and Staphylococcus aureus, 43%, which was the less similar to in terms of epitopes to adalimumab, even though it is also relevant. We study RMS, road mean square deviation values, which measure the average structural deviation between aligned molecules, and RMST values below 1 angstrom indicate an exceptional high degree of structural similarity, often reflecting near identical alignment, increasing the likelihood of cross-reactivity. These are the predicted epitopes. We predict 5 epitopes and their corresponding sequences. Residues ranges from 4 to 16, and CDR, CDRs recognize 4 residuals onwards. However, that does not make the 4 residuals less relevant. And the closer the score is to 1, look at here, here are the scores. So the closer the score is to 1, the more robust prediction is. For example, here, 0.8 suggests a high level of confidence of this conservation and potential functional relevance across bacterial homologs. We perform alignment of homology model with praline comparing adalimumab with bacteria antigens. Here you can see the general analysis of adalimumab with bacteria, non-binary or not 1 by 1, but general analysis. Blue areas are the least conserved, and red areas are the most conserved. And when we also did binary analysis comparing only adalimumab with E. coli and with Corynebacterium pyrovici producens, which were the ones with the highest homology. And this binary analysis shows that there is a high degree of conservation. As you can see here you can see the degree of conservation of adalimumab residues were with these bacteria. These are the structural models we obtain. They show bacterial antigens containing immunoglobulin domains from various microorganisms who serve, these immunoglobulin domains serve diverse functions, including molecular transport and toxin elimination. For example, in Enterobacterium, these immunoglobulin domains contribute to host adherence and invasion. And you can see here, when we overlap the adalimumab, for example, here is light chain, but also we study the heavy chains. You can see the overlapping with bacterial antigens, and you can see the tremendous similarity. You can see here adalimumab in brown, and the structure of light chain of adalimumab and the structure of bacteria, and they are really, really similar. Here you can see the prediction of epitopes at 3D level. In the adalimumab light chains, we predict 5 epitopes and their location. You can see here the location of the epitopes predicted. In this 3-dimensional model, we can observe the space occupied by these epitopes in adalimumab and how similar are the epitopes in bacteria. You can see here and here. Also, here is the conservation analysis. Here is the linear sequencing, and here the 3-dimensional structure of adalimumab. Purple areas show the conservation of bacteria epitopes. Look at this here and here with adalimumab epitopes. So, when we study potential role of molecular mimicry of bacterial epitopes in the loss of effectiveness of adalimumab due to anti-drug antibodies formation, we conclude that decreased adalimumab effectiveness can be associated with antibody formation. The exact causes of adalimumab formation remain unclear. Previous infections may contribute. Molecular mimicry is a possible explanation. The bioinformatics approach is helpful in the study of molecular mimicry. By identification of homolog bacterial antigens through this in silico evidence. However, these findings require further validation through in vitro and in vivo studies to confirm their biological relevance. Molecular mimicry has a double impact. It may inform rational drug design, but it may also trigger harmful immune responses that reduce treatment efficacy. Accounting for molecular mimicry could lead to improved monoclonal antibodies formulation with lower immunogenicity. In the context of precision medicine, it is essential to consider drug microbiome and drug pathogen interactions when designing and administering biologics. In conclusion, some microorganisms exhibit molecular mimicry with adalimumab, potentially triggering the development of anti-drug antibodies in individuals with previous infections. Assessing molecular mimicry in adalimumab is essential to prevent adverse immune responses and safeguard therapeutic efficacy. Bioinformatic tools through in silico analysis offer a means to predict potential cross-reactivity between pathogen-derived antibodies and adalimumab. However, further validation through in vitro and in vivo studies is necessary. Thank you very much. If you have questions, I'm ready to answer.
Thank you so much, Dr. Alejandra. Please, if you have any questions, you can left in the chat, or you can also open your mic and camera and feel free to make any question. I think maybe right now there are
Great
no.
work,
Oh, yeah.
Alexandra.
Yes. Sorry.
Hi, Justus. How are you doing?
Hi, thank you. I was late because I didn't get in, but what I heard was exciting. Thank you for that.
No, thank you. Thanks so much for attending.
Thank you, Doctor. Doctor, I have two questions. The first one, adalimumab is a very intersectional medication and well used in several diseases, not only in uveitis. Um, the validation cohort, or you are planning to make a validation cohort there in Colombia, or you are
Yes, yes, sure.
working
As I
on?
told you,
Sorry,
as I
sorry.
told you, this is the first step, because in silico analysis is just a modulation regarding molecular mimicry. In this case, adalimumab with bacteria. But it is necessary to confirm this immunogenicity factor through in vitro and in vivo analysis. So we are planning to make an in vitro analysis with patients presenting anti-adalimumab antibodies receiving the medication, and patients that are not that have not these monoclonal antibodies in as a response. So we are planning to make ELISAs in vitro to see if the antibodies addressed against a monoclonal antibody, in this case adalimumab, are also addressed to the epitopes presenting in this bacteria.
Wow, thank you very
As you
much.
can see, the when we have a similarity more than 30%, it is possible to cause molecular mimicry. But what surprised us is that we found 94%, for example, of similarity with E. coli. This means that antigens of the immunoglobulin domains of these bacteria are almost exact as adalimumab epitopes. It was a real surprise because, for example, E. coli is so common, and we choose 8 epitopes, 8 antigens or 8 bacteria because we found at the beginning more than 40, but we choose the bacteria that were relevant, clinically relevant. And it was a surprise because, for example, Corynebacterium pyrobici has a similarity of almost 90%. E. coli 94%, and Klebsiella pneumoniae 82%. So this is really an important result because probably, as I told you at the beginning, this is not the only factor. I mean, molecular mimicry is not the only factor for immunogenicity. There are also structural properties of proteins or drug-related factors or patient-related factors, but molecular mimicry has been associated with other immune diseases, but also with patients with previous infections can develop anti-drug antibodies. And this has been demonstrated in patients with multiple sclerosis, rheumatoid arthritis, intestinal bowel diseases, that they have a higher likelihood of developing anti-drug antibodies after presenting infections.
Thank you so much, Doctor. Dr. Lindell is asking here, are there difference in level of mimicry between biosimilars of adalimumab? For example, were the preserved epitopes the same across biosimilar of adalimumab?
It is a good question. We actually explored the molecular mimicry with adalimumab, but this question is really important because we should study the biosimilar medications also.
Thank you so much, Doctor. Doctor, my second question is related to the regions that you take for the antigenic identification. These are the non-variable regions of the bacteria because some serotypes can change between like
Yes, yes,
okay, okay.
yes,
Thank you so
yes.
much,
Mhm.
Doctor. I don't know if anyone have any additional question.
Nope. It's
Thank you.
because
Is that a
nobody
terrific topic?
understand anything or
No, I think it's a very novelty topic and it's very impressive what you have done, Doctor. Really, really, I admire you a lot, like all this work and everything that you have done. It's just amazing, and thank you so much for the time. I think maybe if
my
you have
pleasure.
any your email there, someone of the people that is in the talk or the people that are going to see this video in YouTube can write to you and ask many questions. I think that could be another way. But
Yeah.
really, really appreciate, Doctor, your time and all
My
this
pleasure.
amazing talk that you and all these discoveries that you have done, and hope your cohort comes very well, and looking forward to see this amazing paper. Thank you so much,
Okay,
Doctor.
thank you. Thank you for the invitation. It's my pleasure to be here. Thank you so much.
Thank you. Bye bye. Thank you so much.
Bye. Take
Next
care.
month is going to be the a Proton Lecture Series with Dr. William Rojas and me. So all also are very welcome and invite to attend. hope to see you all there. Thank you so much. Goodbye.
Okay,
Have
we'll
a great
see
day or
you.
night. Bye
Bye-bye.
bye.
Thank you.